Types of anxiety disorders. Anxiety is a natural response to uncertain and threatening situations. However, for some people, anxiety can occur in many situations. Excessive anxiety can make a person avoid daily activities, withdraw, and possibly experience panic attacks. This situation can be categorized as an anxiety disorder. In general, the types of anxiety disorders are: 1. Social anxiety disorder. Social anxiety disorder. This disorder can be seen by measuring how afraid the sufferer is of interacting socially with other people. People with this disorder tend to withdraw from other people and do not feel comfortable when they have to speak in public. Social phobia tends to be inherited from parents. However, it is not yet certain whether this condition is triggered by genetic factors or the result of wrong parenting, for example being too restrictive. Another possibility is that children imitate the behavior of their parents who often feel anxious when dealing with other people. Can social anxiety be cured? The following are tips for reducing anxiety. 1. Recognize anxiety triggers. When experiencing social anxiety, it is important for us to know what kind of situation causes it. Triggers for anxiety disorders may be different for each person. By knowing the cause, you can find the most appropriate way to overcome it. 2. Take a deep breath. Try taking a deep breath and holding it for 3 seconds, then exhale. Do this continuously until the body feels relaxed and the nerve activity in the brain that causes anxiety decreases. 3. Change the way of thinking. People who experience anxiety often think that their existence is undesirable and is viewed negatively by their environment. However, these thoughts are not necessarily true. So, from now on, change our perspective on the world. If you think there are too many negative things in this world, it means there are also many positive things in it, which you may not know yet, if you look at the world from a different perspective. 4. Face the fear. The best way to get rid of the fear of meeting people is to meet more people. Even though it is difficult, you still need to face these fears. Avoiding what makes you anxious will actually make your fear bigger. This method may not work in one try, so you need to keep doing it until you get used to it. This condition of social anxiety can be cured, as long as you are serious about treating it. Then also consult a doctor so that the doctor can give you medicines that help you to relieve anxiety. Don't forget to also pray to God, because by praying, at least you have given half of your problems to God. 2. Panic disorder. A panic attack is an intense fear that appears suddenly or is triggered by a trigger. What causes panic attacks? As previously explained, a panic attack is a condition that can occur suddenly. Usually, situations that can trigger panic attacks are situations where someone feels threatened but cannot escape from the condition. Panic attacks can occur at any time, either because there is a trigger factor or without a trigger factor. If you have ever experienced extreme anxiety and fear that came on suddenly, which made your heart beat fast, you felt nauseous, you couldn't breathe normally, and perhaps felt like you were dying or going crazy, you could be experiencing a panic attack. Each person's experience of experiencing a panic attack can be different. However, we can see the symptoms of a panic attack in signs that generally occur frequently, such as heart palpitations, shortness of breath, feeling of choking, trembling, nausea or stomach ache, excessive sweating, feeling dizzy and unsteady, feeling numb, feeling unreal or detached from the environment, feeling afraid of dying, losing control, like going crazy, or like there is a trap in the mind that is difficult to release. How to overcome panic attacks. Even though this all feels very scary, it is important for us to remember that panic attacks will pass. This condition has a solution and can return to normal with proper treatment. If you are in this situation, there are several ways to relieve panic attacks or eliminate the condition in order to return to normal conditions as before, including: stop for a moment to find out the trigger. Observe the thoughts and feelings that follow. Try to realize whether this can be overcome or difficult to overcome. Try relaxing your muscles and regulating your breathing. Use the 5-4-3-2-1 method to make yourself calmer. From how to deal with panic attacks above, maybe you are wondering how to apply the 5-4-3-2-1 method. The following is the explanation. Search and observe 5 objects. Listen and observe 4 different sounds. Touch 3 objects. Observe the texture, temperature, and function. Identify and observe 2 different odors. Name one thing that you can taste and observe the taste. There is no specific cure for panic attacks, but there are various treatment options that can be practiced to help manage the symptoms. 3. Specific phobic disorders is a feeling of excessive fear that occurs in a person, towards a situation, or a certain object. It is natural for us to feel afraid of things that can harm us. However, for some people, the feelings of fear they experience are so great and overwhelming. They feel very anxious when triggered by certain objects, situations, or figures. Therefore, they try to avoid things that can trigger their fears. There are 2 types of phobias, namely specific phobias and complex phobias. For the types of phobias, we will make a separate video in more detail later to discuss the types of phobias. 1. Traumatic events. Situations that have occurred can cause a person to experience trauma, resulting in excessive fear of certain situations, objects, or places. 2. Environment. Phobias can also arise as a result of a response to environmental conditions around them. What are the signs of a phobia? Phobias do not only appear with psychological symptoms such as fear, because this mental disorder can also affect physical conditions. Here are some physical symptoms that can occur in sufferers: disoriented or confused, dizziness and headache. The chest feels tight and painful. Hard to breathe. Heart rate increases. Body shaking and sweating. Ears ringing. Sensation of always having to urinate. Mouth feels dry. How to treat phobia treatment. Usually, doctors will use a combination of medication and psychotherapy to treat it. Psychotherapy can take the form of exposure therapy to change your perspective on a frightening subject or situation. Cognitive behavioral therapy, or CBT, which combines exposure therapy with other therapies. The CBT psychotherapy method focuses more on how to control the sufferer's thoughts and feelings. Apart from that, treatment of this problem can also be through administering medication, which is hoped to help reduce the symptoms that appear. So it is recommended that you immediately consult a doctor about your health so that appropriate and accurate action can be taken. Okay, maybe that's all the information about anxiety disorders for now. Hopefully it can help all my friends. May Allah subhanahu wa ta'ala give us health and safety. Amen. Wassalamu alaikum warahmatullahi wabarakatuh.